this conference, I gave 2 lectures. One was a Meet the Expert session where I gave together with one of the colleagues and a urologist about the choice of antibiotic prophylaxis in an era of multi-drug resistant. And there was a very interesting discussion of how and when should we change antibiotics or considering changing it and to what, and how to incorporate in high-risk surgeries targeted screening and change of prophylaxis according to screening results. The other subject that I've covered in a lecture was the epidemiology of multi-drug resistant Acinetobacter. It's a growing problem in many ICUs, especially in mechanically ventilated patients that have either pneumonia or bacteremia for multi-drug resistant Acinetobacter. And I covered the explanation of the epidemiology, how it spread, different modes of spread in different locations or geographical areas, and how should the infection control intervention be tailored to the specific epidemiology in each specific area. In some location, there is a clonal outbreak, meaning one organism spreading from one patient to another and from one unit to another and causing an outbreak, and that it's very clear what the intervention should be. In other places, what appears to be what we refer to as polyclonal outbreaks. So when you take the organism and check them, although it seems that you have many cases, you see that every organism is from different clone than the other. And that is usually interpreted as we don't have an outbreak. But what I've actually showed is that if you do a longitudinal study and you look at that, what you realize, it's not that you have no outbreaks, but actually you have several outbreaks progressing very slowly at the same time. So you can do. There are several studies that have shown that it's actually accumulation of outbreaks that happens, and that usually shows that you have environmental reservoirs over time. So the hospital, because the Acinetobacter survive in the environment for a very long time, you have a hidden reservoir in the environment of the hospital, which starts outbreak from time to time. ICPIC is a place where you can meet and see and exchange ideas with the entire infection control community of Europe, but also outside of Europe. We have a lot of American colleagues and a lot of colleagues from Asia, Latin America, and other places in the world. So I think it's a very interesting opportunity to exchange ideas, to learn from other people's experiences, and to discuss problems that are either common or specific to special occasions.